What's tendon breakdown?
Tendinopathy.
Tendinosis.
What's tendinopathy then?
Yes. Itis means inflammation.
What about ISIS?
Well, you can have opathy that isn't itis.
Is it funded by the CIA as well?
Oh, this is weird because I'm on the other side.
Oh, because it's mirrored.
Yeah. I don't know how to have my legs. So.
Oh, do you want to sit with good posture?
Fuck posture, man. Posture doesn't mean nothing. The only bad posture is static posture.
We are at Melbourne Strength Culture with Jamie and Charlie.
Welcome to the culture. That's easy. That's the intro. We'll start laughing, cut, and then start. Yeah, thanks. Let's go.
All right, so I put a call out on Instagram, and what we're doing today is we're doing a Q&A. So I've had a whole bunch of people ask questions on the Instagrams, and we're going to answer 5 of those questions, the ones that received the most likes, in depth. We're going to give you a little bit of information, and the kind of topic that we're covering today is injuries. Charlie and Jamie are both super educated guys, great coaches, great powerlifting coaches, and are very well versed in injuries, both on a personal level and with the people they deal with, and in terms of the actual formal studies. So we've got a heap of questions to go through. We're going to be as thorough as we can with every single one. So yeah, let's go through them. Yeah, and I'm going to edit this into the, I'm going to print screen and put it in. Okay, so the first question we've got here is from Drew.BarbellJustice. He says, any tips for rehabbing chronic patella tendinopathy? Now I know you dealt with it a little bit.
Yeah, I did for a long time. So I had chronic, well, it built up to be chronic over a 2-year period playing football. In that meantime, I was still squatting, deadlifting, not as serious as I am now, because now I'm focusing on powerlifting, but it did get quite bad. It got to the point where I couldn't squat, so I took a year off squats, and what I found helped the most with it was isometric holds. But then ultimately I did source a physio, injury rehab center. They helped me out. They 4 or 5 month rehab program, seeing one of the physios there, which helped. But basically isometric holds were the big factor, and rehabbing the muscle, because I literally had no left quad. It had deteriorated to nothing. We've got a photo, I'll chuck it up. I'll send it to JP and we can chuck it up and you guys can have a look at that. But yeah, so I had no quad. So pretty much when I was playing footy, the whole tendon.
So you just have it in one leg, not the other?
Just in one leg, okay. Just in the left leg. So basically isometric holds, we had to rehab, bring back the muscle in the quad over a 4 or 5 month period, and then we introduced squats back into the program. And then I think the biggest thing with my experience with it, with tendinopathy, was it is a bit up and down. You have weeks where it felt really good, and then weeks where it would regress a little bit. But basically my physio told me to use a scale. If it was no worse than a 3 out of 10, he's like, train through it. He's like, if it starts getting to a 5 or a 6 out of 10, then pull back on the volume of the rehab stuff or whatever the squatting I was doing. So that was a good way to gauge it, and that would kept me sort of sane, because if I did relapse a little bit and it would get, go from a 1 out of 10. You had
direction, you knew what to do.
Yeah, I knew, it's only a 3 out of 10, I'll keep pushing through, because that was the biggest challenge, was that it didn't just go away. It was a 4, 5, 6 month period of up and down, up and down, up and down, floating between that 4 out of 10 pain, that 1 out of 10 pain. So 2 weeks it could be great, then I'd do some squats, do some my rehab exercise, and I'd feel it again. So be patient if you are rehabbing it. I do suggest seeing someone.
Allied health professional, yeah.
But isometric holds are probably your best bet.
Yeah, so we can go into the isometric holds a little further. We have a protocol that we use here for people that present with pretty much all tendonitis or tendinopathy issues. But isometric holds are analgesic in nature for tendon issues. So if you are presenting, so if you're warming up and so I know a lot of people like play basketball and all that sort of stuff, can sometimes inflame their tendon just from an acute exercise like that. Isometric holds before you actually squat. So we do 3 sets unilateral up against a wall, like a wall sit. 3 sets of 30 seconds to a minute per side. That can actually be analgesic to the point where you might not actually experience pain through your squat session itself.
Okay,
so you can almost
that immediate.
Yeah, so you can almost use it. I know Charlie also uses it with elbow
at the moment. So I took my squat grip from a thumb under to a thumb over, and for some reason started getting 3 sessions in, a bit of pain, inflammation. And literally, I don't even do it that regular. I do it my 2 squat days a week. I literally do 4 or 5 sets of isometric holds with a 17.5 kilo dumbbell. And I get through my session pain-free, feels good, doesn't hurt the next day, and it has, so yeah, isometrics are probably the number 1 go-to.
Isometrics would be your best bet. But then also addressing, and I know we had another question on this, addressing the tendonitis or tendinopathy, whatever you're going to call it, it could actually lead to, as in Charlie's case, some atrophy of the muscle, where strengthening that is going to be your best effort long term for getting rid of or clearing the
That's
way.
where like addressing the root issue,
Yeah,
like what
yeah.
caused the patella tendinopathy. So you can get rid of the pain, but if you go back to full-blown training straight away, it'll just come back again.
Yeah, you still got to address
some single leg testing at the injury rehab centre, and I remember we did 100, might have been 80, 100 kilo leg press, one of the two, but got like 17 reps or something to failure on my right, and it was like 3 or 4 reps on my left.
Okay.
So you can imagine the loading issues when you're then squatting,
bilateral movements, running, jumping,
jumping, playing football. Yeah. So there could be an underlying issue then. If that's not addressed, your tendinopathy.
You can get rid of the pain, but it'll keep presenting.
It'll keep coming back because you're obviously not addressing the root issue.
Cool. Next question comes from Shri Bees. How to deal with unequal strength, for example, leg strength, that may lead to favouring one side over the other, leading to imbalances or injuries. Thanks.
Yeah. So this, I guess, directly comes straight off that first topic. I think the most important thing is to actually do testing, as Charlie did with his tendinitis, and actually address, so you can actually highlight what you need to fix or what you need to address with your training protocols.
So do like unilateral testing?
Unilateral testing. The big ones that we use here are one-legged box squats. So where you hold a plate in front of you, you squat down to a box, push the plate in front as like a counterbalance, and it's a really good way to address quad and glute issues on that one side. And then also we use one leg.
Is that a test or is that?
You could use it as a test.
Okay.
As like a fatigue test.
Yeah,
so
but
like,
also a strength.
Yeah, exactly. We use chains, so we've got chains on the back wall here. We throw them over the shoulders, so we can load up, and then we have about a 10 kilo plate that we use as a counterbalance. So you could use that as testing protocols. So like maybe like a 10 rep max test. So you do your strong side first, and then strengthen or compare it to your weak side. And then from there you can implement that as your training intervention as well to strengthen.
So would you recommend, like let's say someone's got a normal squat program, whatever, and they realize, okay, the left leg's lagging, would you simply add more volume onto the left leg? Like you just get them to do an extra 2 sets of split squats at the end of a workout?
So
or would you, like how would you alter your training?
We've attacked this a couple of ways. With one person who was hip shifting heavily in their squat, we actually used it as like almost like a pre-fatigue, like that.
So before you actually did your
yeah, but it wasn't like a massively pre-fatigue.
Three sets of 5.
We did 3 sets. Yeah, I think it was 3 sets of 5 or 6 prior to their actual bilateral barbell squat movement. So we used it in that nature, and then we had another person who was hip shifting, and we used it as like a muscle building hypertrophy sort of protocol post the bilateral session. Both of them actually worked really well. Okay. So I think it'd probably be one of those things where you play around with it.
We program the same weight and rep scheme for both legs. So it's not like just because your left is weak, just do the left work. Like still do the same.
Okay, so you still do on both legs.
On both legs, but you don't.
But obviously the weaker leg is going to get more of a stimulus because it's harder.
So you're probably going to feel it more in, let's say, your left leg if that's the weak one. You're going to feel it more in that leg, but you're still going to do the same work with the same weight on the right leg.
Okay, yeah. So you might
over time.
So you might do Bulgarian split squats. You know, a set of 10 on one leg, a set of 10 on the other leg.
The same weight.
Yeah. Okay. Cool.
So you're trying to over time.
Bring that discrepancy together.
And I guess the biggest ones that we've used to great success here are one leg box squats, as we talked about, one leg RDLs, which we can overimpose a little video of here as well, and then one leg hip thrusts, all adding as much load as possible and training it as you would any other movement.
Normal strength movement.
Yeah.
Okay, cool.
I like these names.
Yes, these are pretty good names.
Names of
Man, I thought
burgers and a rehab.
Right, next question comes from burgers_and_rehab.
It's a good name.
Great name. How to avoid lower back injury from low bar squatting and sumo deadlift? And I guess just deadlifts in general. He doesn't say that, but I guess from
just deadlifts in general.
How to avoid low back injury? Well, that's a pretty hard question.
That's a very broad, open.
Depends on the mechanism of the injury.
Yeah. With the lower back especially, there's a lot of things that can come about through injuries, and obviously heavy loading movements, barbell squats and deadlifts.
What do you think are the most important factors to kind of prevent?
The first thing we always seem to address when there is someone with low back injury, and it's not an acute injury like that, like it's just sort of over time after, is core position.
Yeah, okay.
Yeah, core breathing and bracing. So we talk about, so we've done a video before on the 90-90 hip lift.
Continue.
That is our first port of call, 9 times out of 10.
YouTube channel, check it out.
Literally, it does so much for addressing motor control issues surrounding the lumbopelvic region.
So you think the biggest mechanism for low back injury tends to be not so much like, you know, total training volume, like you're training too hard, but it's more so your position in the first place. And
I feel like the positional technique stuff leads into the actual volume overload. Yeah. So you might not flare up or whatever from your training volume, but if you put poor technique with that training volume, then you're going to arise an issue. Because good technique in the end is...
You see it time and time again when most people do extend in their squat. Like
Yeah, okay, they got that extension bias. They load the
lumbar
low back.
extension, and over time, heavy load, we know what's going to happen.
Yeah, okay.
So I think,
the most important thing is just position technique.
Setting a good position, but having good motor control, not just in the barbell lifts, but across all lifts. We use frontal plane lifts, lateral lunges, single leg movements, different barbell positions.
I use even in my own training, when I get programmed Bulgarian split squats, I use them as a tool to help feel my core position and my midfoot.
Okay,
which then gives me better context for my squatting.
Actual squatting. Okay.
So those accessory movements can go a long way in teaching and giving you better context for your bigger lifts, which is going to hopefully prevent injury from occurring.
Next question comes from Elizabizzle_Manizzle. She's actually one of the members from the gym, man. She's
Yes.
What a name.
She goes, what are some of the most common injuries you guys see for each of the 3 lifts? So it's going to be brief. And how would you reduce the risk of these common injuries? All right, squat, most common injury.
Probably anterior hip pain or lower back pain.
Okay, yeah. And how do we
we sort of just spoke about that in the last question.
Control your extension bias.
Yeah, pretty much that. Core position.
Most common injury in the bench press. That's probably one we can elaborate a little bit.
AC joint's a common one, and we've also got videos on our YouTube addressing this, but so we address reaching, so serratus anterior lower trap.
So just like joint issues.
Yeah, so I think the biggest thing with the bench press, we touch on it a lot, is movement variability and actually getting away from that extended thoracic spine, depressed, posteriorly tilted, retracted scapular position.
Yeah, so you're not getting away from it when you're bench pressing. Away from it outside of
in your training. So you talked about in your last video some variability just in training in general. We believe that it's extremely important for your upper body because of the
things.
Because the power lifts generally tend to train extension patterns, particularly of the shoulder blades coming into retraction, depression, posterior tilt. Getting away from those positions with your training, we use push-up variations, landmine press variations, a lot of core thoracic flexion movements to try and neutralize that upper body a little more and mitigate all the extension focus that occurs with your training.
To kind of like mitigate the risk of overuse, essentially.
Yeah, and for the most part, that we have seen that's cleared up AC joint issues, that's cleared up tendinopathy issues with the supraspinatus tendon, anterior capsule issues, so bicep tendon, lat tendon, almost pec tendon as well, just general soreness at the front of the shoulder. A lot of that can just be cleared up with movement variability thrown through your program, and not in chunks in the year. We do believe the whole way through your training year.
Cool. All right, and probably the last question here, we got dry dreams.
What dreams?
It's dry, DREI, but it's dry dreams.
So it's
I think
not wet dreams.
It must be like a
WHET.
It must be like a little joke thing.
Yeah, dry dreams.
How do you decide when to rest or work through an injury? I reckon this is a really good question. It kind of ties in a little bit to what you said about the patella tendinopathy thing.
Always work through the injury.
Always work through an injury. I think I made a post about this recently, and it was just along the lines of, I guess the most important part with this question is being able to recognize and decide as to whether or not a pain you have is general discomfort, a sore, a niggle, or an injury. Like those things, I think, can be quite distinct, and you need
a lot of that comes with experience.
Yeah, you do need the practice, and I think one of the things that is pretty common amongst advanced lifters is that, well, not even just advanced, but any lifter that's got more than 3 months of training behind them, is they get sore. Like, my elbow hurts right now, and my neck's been really bothering me. But that's not going to stop me from training. Like, if you took a break every time you had a niggle, you would train once a week every month.
I like that thing about it. You got 100% of your training. 10% is going to be excellent. 10% is going to be shit, and 80% is just that general where training's just getting the work done. You're probably a bit sore, probably a bit tired.
Yeah, it sits in the middle, right? Middle of the bell curve.
Yeah. You're only going to have those 10% of sessions where it's, wow, that was the best session of my life, that was amazing.
Yeah, it happens once a fortnight,
So I think it's just using your brain, really. If it seems like it's been going for a couple of weeks, whatever injury, 2, 3, 4 weeks, and it's not getting better, if anything it's getting a bit worse, well, your body's telling you something.
I think a precursor to this is, if you are worried, go and get it checked by a healthcare professional.
Yeah, of course. Yeah.
I think that needs to be stated. Too many people try and cowboy their way through things, I feel. But if it is, you got to recognise that a lot of these little niggles, as you said, will just be niggles. Exactly.
Well, that's the thing. Like, one thing that comes up all the time in the gym is people come up to me and like, oh, JP, my shoulder hurts. Like, while I'm bench pressing. I'm like, oh, okay. Like, well, how does it hurt? Like this. What's the pain? Like this. Have you ever experienced this before? No, never. This is the first time. Almost my answer every time is, okay, well, I'm just going to ignore it and we'll see how it goes the next session. Yeah, because a lot of the time, like, that pain just isn't there next time. Like, it's just a one-off thing.
So many clients.
Yeah, and the thing is, if it comes up in the next session, it's still there. It comes up again, a third session in a row, I'm like, okay, cool, this is actually an issue, we've got to address it now. And it's not a case of like, oh, I'm going to let it blow up and, you should really nip it in the bud. But a lot of the time, sores and stuff just come up, and you just got to let them kind of run the wave.
With my own programming, my bench press up, I'm programmed 4 days a week benching, and obviously with my shoulder injuries, I'll notice. So I've started to work out the pattern every 3 weeks, 4 weeks. I find that by the end of the week, my bench press of my shoulder just feels a bit shit, and I usually just scrap the bench that day.
Yeah,
and then
it's almost enough to kind of
have a few days off, and then by the time I come back to training on Monday, it's good to go. So I think it's just that understanding and awareness of your own body and how you pull up, and when you do need to pull the pin and pull back.
And I think recognizing that if you do have to take time off training, I saw a really good Instagram story today. It's not the end of the world. Having 4 weeks off in the grand scheme of things is not the end of the world. I know I'll be lifting for the next 15, 20, 30 years. You guys will be the same. Having a 4 week period off of lower intensity work, it's literally a drop in the ocean. It's a big bathtub, and you've just taken one little piece of water.
So many more opportunities to train when something's injured. So, for example, when I was injured with my knee, the tendinopathy, I drilled my deadlifts. So while I was playing footy, I got my deadlift up to 250. Couldn't squat 150 kilos, but so I got my deadlift.
It was almost like an opportunity to work on other things.
Yeah, you got to focus on the things.
I actually also got my bench up to 150 in that time too. So I just had 2 good lifts with a lagging, but I used the time to be better.
And now your squats come up almost on par with all the other ones now.
Yeah, exactly.
Now you can put the work into it
later.
So I guess the short answer of it is it can be hard to judge whether or not you can push through it.
I think use your brain, be aware of your own body and what your body's telling you. Sometimes it is just maybe this session just scrap the bench press, but give it a few days off, you'll be fine. If it's reoccurring over a 2 week period, every session benching or feeling the same pain, then go get it looked at. I feel like it's just
all the YouTube tutorials in the world won't help if you.
Yeah, and with most injuries especially, everything is going to be very individualised to the person. Isometrics might not work for some people. It might work absolute wonders for others. Throwing in some lower trap work may not help an AC joint for whatever reason. So I think it needs to be assessed and overlooked by a professional.
All right, that's a Q&A, guys. Thanks a lot for tuning in. Thanks a lot, Jamie and Charlie, for joining me today and answering some of the questions that you guys had. Where can we find you, Jamie?
J Smith Culture on Instagram, or the gym is just melbournestrengthculture.com.
Charlito?
Same gym, obviously, and quantum_lifting on Instagram.
Cool. If you've got any questions, leave them in the comment section below. We'll be floating around YouTube and answering them as best we can over the next few days. So thanks a lot.
Thanks for having us. What the fuck was that?
That's easy.
This video's gonna be 30 minutes long. It's gonna take fucking forever. Thanks. Can you put this? Any tips for rehabbing chronic patella tendinopathy?
Tendinopathy would be the tendon is inflamed. Are we starting that again?
We're starting that again. Don't even have to go into that. Just be like tendon. Everyone knows what it is.